Welcome to Adapt NCLEX. Thank you for deciding to watch this video. Are you preparing to take your NCLEX? Fundamentals is a key concept you need to know. Today, I'm going to walk you through the must-know fundamentals, some key concepts you need to know. It's a building block for your nursing career and then for your NCLEX. As you can see, the first question of conflict resolution, look at it. These are stages of how to address conflict. And the best way to master them is based on the words. Think about it. Whenever there is a conflict, either you run away from it, you avoid it, number one, or you fight for it. And that is what? You're fighting for your own information, or the person is trying to push his information on you, his desire on you. That means you got to accommodate them. If you don't, and then both of you has to fight for a position, that means you compete. Competition. If you don't, while you competing, that means you want 100% of each of your view. If that doesn't happen, you compromise and you are 50-50. All sit down, work together for a solution. Therefore, avoidance, one word, you step away from it. Accommodation, the individual will is tramping you. So what are you going to do? You got to accommodate them. Therefore, you one prioritize other needs of the other person rather than you. If you're competing, then both of you, you're trying to pursue your own goal. I'm competing, and you two, you're competing, right? If you compromise, what does that mean? We come to a middle ground. But we collaborate, we work together to solve the problem. And this is the way it's supposed to do. This is the way it's supposed to look. If you don't know it more, check out that 10 class. This is the first question. Number two, which of the following client has the highest risk of experiencing family or community violence? Keyword, violence is very common in a female, older patient, or young patient who are less than 3 years old. That's all. You don't need to worry about anything. 60-year-old is more than, it's less than 70, right? And he's retired, but he live independently in assisted living. He's not living with anybody. You cannot, and it's a male. It's not a female. It's good. A female who is pregnant, more likely to be abused. 5-year-old with the ADHD, of course, he has some mental problem, but it's more than 3-year-old. He's just hyperactive. You cannot abuse him. 15-year-old female whose boss is strict and authoritative. Yes, the boss is strict authoritative, but that doesn't mean there's likely to be abuse compared to a 30-year-old who is pregnant. It's a female who is pregnant is more likely to be abused compared to a female whose boss is 19-year-old. Just because the boss is authoritative and strict, it doesn't mean it's an indication for abuse. Therefore, a kid who is less than 3-year-old, an older patient who is a female, and greater than 70-year-old, and a pregnant lady more likely to be abused. And so those are the information here. Which room is appropriate for a client who is post-operative following cholecystectomy? After surgery, which room do you put this patient? Test taking strategy. For infectious disease or infectious control or room assignment, don't infect the other person and make sure the other person are going to be safe. So if you immunocompromised, you don't put them together. This patient had surgery. I don't want to infect them. Somebody with a reflux, he has no signs of infection, right? Somebody with head injury, no signs of infection. But what is the key? These patients need multiple care, right? You don't need to go to them most of the time to figure out what is going on. So quiet environment as much as possible compared to somebody who has cholecystectomy. You have to follow up with them, make sure they don't get complication. Therefore, head injury patient, most of the time they are in ICU. Cholecystectomy is on the floor, on the ward. Therefore, they cannot be together. Scabies, infection. Diphtheria, infection. Therefore, the only person who can be in that room is room 1. Which nurse cares for a nurse cares for a client with a new tracheostomy tube placed 48 hours ago? During assessment, the client was accidentally decannulated. Which action should the nurse take first? Test taking strategy, read it from the back. Which action should the nurse take first? A nurse cares for a client with a new tracheostomy tube placed 48 hours ago. Which assessment the client was during assessment, the client was accidentally decannulated. Which action should the nurse take first? Think about it. New tracheostomy, that's the buzzword. 48 hours, it's not matured and it came out. You should never put it back in. The key concept for this question, never put it back if it's less than 7 days. Therefore, if it's less than 7 days, I'm not putting back the tracheostomy tube. You need to close the hole, put something on it, and bag mask the patient. Calling the doctor is not going to help. Inserting a new tracheostomy for a new tube is not enough. Covering the stomach side and then ventilating the patient is the best answer. Oxygen is not going to help because it's going to leak from the hole over there. So if you're less than 7 days, cover the hole and intubate them out. You should never put it back in. You should cover the tracheostomy stoma on the neck and bag valve mask the patient. If it's more than 7 days, you can put the chest to another tracheostomy back in. Which action need immediate intervention by the precepting nurse? That means we get to intervene. A precepting nurse observe a new graduate perform tracheostomy suctioning for a client. Which one need intervention? Concept. Apply pressure when inserting the chest tube. You know that you should never apply pressure when you're inserting a chest tube, right? It's not the right thing, right? Limit suctioning to 10 seconds during each suction pass. Yes, it should not be more than 10-15 seconds. Pre-oxygenate the patient to what? 100% before the insertion is good. Wear sterile gloves is good. Pressure set to 100 to 180 to 120 is good. Therefore, there's only one answer choice that I needed. The wrong one is wrong. Which practice contributes to maintenance of medical asepsis in the client environment? The new graduate should utilize, select or apply. A new graduate has attended staff education about medical asepsis. Which practice contribute to maintenance of medical asepsis in the client environment? So which of these you will show medical asepsis? Emptying use bath water in the sink without splashing is good. Placing dirty linen in the hamper is good. Clean rooms from the cleanest portion to the dirtiest portion is good. Carry laboratory specimen to the lab in the palm is not good. You should put it in the plastic bag. Place dirty linen on the floor is not good. So which one is indicated is this? This will ensure asepsis. Which specimen collection the nurse should delegate to the UAP? A registered nurse, LPN, UAP are working together. Which of these a UAP would do? Anything that does not require sterility and anything within their purview, right? Does not require thinking. Urine from a Foley catheter is a sterile technique. It's a specimen collection. You require a sterility to do that. It's not appropriate. Blood for ABG it requires a lot of technique to do that. Wound culture, it requires an assessment. Stool for fecal or cord blood is easy for a UAP to do, no problem. Which assignment the child nurse should question? Which one is not appropriate for who? A child nurse is reviewing nurse assignment to a UAP. Which one you should question? Something without is out of their purview, out of their practice scope, right? Check the position of a client in the soft wrist restraint. Position is easy. Does not require thinking. Just checking the position. You can tell if the patient has fallen down or in the wrong position. Sit with the client at risk of fall, sitting down and observing nothing. Accompanying a client with what bipolar disorder to therapy. I'm just working with you. I'm not doing anything. Titrate the oxygen therapy for a client to require assessment to see what is going on with the patient. They cannot do that. You should question this. Which of the following tasks can a nursing supervisor assign to unlicensed assistant personnel on a unit? Select all that apply. The same thing. Which one they can do? Reinforcement is not done by UAP. It's done by RPN. Monitoring RN finding is by LPN. Assist with ambulation, they can do that. Assist with range of motion, they can do that. Take vitals before blood transfusion, they can do that. So those are all acceptable. Which herbal medication the nurse should advise the client to stop? Select and apply. A nurse is providing teaching to a client who takes several herbal medication currently prescribed warfarin. Which one they should stop? Stop. Test taking strategy. Keyword is warfarin. Stopping. That means anything that interact with each of these medication with warfarin, you should stop. One key concept you need to know, multiple G's are always bad. Ginseng, garlic, ginkgo, ginger, and green tea, of course. St. John was also can affect warfarin through the liver function. So this is also acceptable. What is the next priority action? And there's a client receiving TPN suddenly develop diaphoresis, shakiness, and confusion. What are the buzzwords? Diaphoresis, shakiness, and confusion. And what is the key priority? You got to be sharp. Which of this is going to save the patient? Which of this, if you have 1 second, you should do will help you. I have diaphoresis, shaking, and confusion. What do you think is going on? You need to figure out. Or the healthcare provider for a new TPN order, bad choice. Check the client blood glucose level. It's going to do assessment to figure out why you have diaphoresis or shakiness and confusion. Prioritization 101. Giving the patient 50% dextrose IV without knowing what is causing the problem, you are not helping them. Decreasing the TPN is not good. It's having symptoms. Check the level. Which is the most therapeutic response by the patient, by the nurse? A nurse is caring for a client who has recently lost their job. The client say, I feel so useless. Therapeutic communication. Let the patient talk. If you're talking, you are not helping. If you want to talk, ask for more information. Which of these information the patient is talking or asking for more information? Don't feel that way. Things will get better. How do you know? Have you thought about finding another job? That's not what he's asking you. I'm here to listen. If you want to talk about how you are feeling, Nancy is talking and asking for more information. Excellent. You should try to stay positive about your situation. She does not care. She said, I feel useless. You want to know more why she feel useless. Which food should the nurse recommend as a good source of folic acid? Keyword, folic acid. Look at this answer choice. If you know one has folic acid, pick it. Whole milk, vitamin C, D, and calcium. Lean chicken is a protein. Spinach and fortified cereal, very good source of folic acid. A pregnant lady should take. Which action by the new graduate indicate need for further teaching? That means they're doing something wrong. So you got to intervene. Precepting nurse observe a new graduate prepare a sterile field. Sterile field as areas that need to be what? Sterile and unsterile. What are the things you tell them or what you need to know to show sterility? The sterile field height is above the new graduate waist. So far as it's above your waist, is good. No object should be placed on the outer perimeter. 1 inch perimeter is not sterile. So that's good. And below, if your hand should be above to your waist. If it's below your waist and it's in front, it's bad. This answer choice is partially correct. Your hand should be in front of you, but it should be above your waist. That's why it is. And the sterile object should not be dropped very high. It should be dropped close to the sterile field. So that one. And has received an order to administer 500 milligrams of medication to the client daily. This is the medication label. 500 milligrams in 5 ml. 500 milligrams in 5 ml. No, 250 milligrams in 5 ml. And you're supposed to deliver what? 500 milligrams. It's straightforward, right? Prescribe and what? Available times how much you're supposed to give. So what is going to do? If there is all the medication is available in 250 milligram and 250 milligram, I give you only 5 ml. If I'm giving to give 500 milligram, it should be 500 over 250 times 5, and that will give you 10. So this is a dose calculation, straightforward dose calculation. NS graduate perform peripheral pulse assessment of a client as follows. A new graduate, you should say a new graduate nurse perform Peripheral pulse assessment of a client as follows. The location is behind the medial malleolus bone of the foot. What is the problem? Is the right foot right? We have diminished our belly papa hole, right? And the left is normal. So what do you think? This is the location on the medial malleolar. So this is the leg, and the medial malleolar is right here like that. And the behind this guy right here. Your ankle is here. And on the right, there's a diminished and barely palpable pulse. On the left is normal. Which documentation is appropriate? Think about it. Which documentation is appropriate? So you have to know the gradation of the pulses. First, you got to look at the location. Medial malleolar, whatever is behind it, is posterior tibia. I see dorsalis, and dorsalis is gone. A normal pulse is usually +2. Therefore, if I look at it, this is +2. Hey, something that is diminished and barely palpable, it should be 1. But both of them, even though it's a barely palpable, both can be palpable. Therefore, bilateral posterior tibia pulse is present. That's right. And the right side is what? +1 because it's diminished. It's not normal. Left is normal. So 2. So the right answer is D. This is a little bit hard question, but you got to think about your assessment. So this is what it look like. Absent is 0, diminished is 1, normal 2, strong and full is 3, and bounding is 4. And next is assessing the client peripheral pulses. Match the following assessment finding with appropriate force of the pulse. That's what we just saw. We already know normal has to be what? 2, right? If you 1 is going to be diminished. If you're absent, it's going to be 0. If you're bounding, you have to be 4. And if you full and strength, it have to be 3. Once again, if it's normal, it's 2. If you're absent, you don't have any pulse. If you diminish, it should be less than normal. That's +1. If you full, 3. If you're bounding, it's 4. So this is the how to match them. Which of the following statement by the client indicate additional teaching is needed? That means we have to provide teaching. And next is teaching a client how to use metered-dose inhaler without a spacer. That's the key, without a spacer. So if you have an inhaler in front of you like that, and there's no spacer, there's a certain way you can use it. I will compress the canister and inhale through my nose. You never inhale through your nose. You inhale through your mouth because the spacer go through your mouth. For 3 to 5 seconds. That's not good, right? I will hold my breath for what? 10 seconds after inhaling the medication. Yes. I will shake the canister so that everything mixes together 3 to 5 seconds before using the medication. I will tilt my head back and exhale before using it. You practice so that you can take all the air from your lung. Therefore, which one need intervention is this. Inhaling through your nose is not right. So you inhale through the mouth, not the nose. Which of the following interventions is most important to prevent a urinary tract infection, right? And this is caring for a client who has a Foley catheter. Foley catheter, urinary tract infection. Those are my T words. Focus on it. Keywords and the buzzword. Therefore, what is it? Empty the catheter every, 12 hours. Too long. At least 4 hours is good. Maintain a closed system and perform hand hygiene. Hand hygiene will prevent infection. Closed system, nothing going in. It sounds good. Apply sterile dressing around the catheter insertion tip. It's not going to help you. Irrigating the catheter every shift. You're not supposed to irrigate them. Like I told you, it's concept and we're going quickly, right? What intervention is most appropriate to prevent skin breakdown? And this is caring for a client with urinary incontinence. Keywords, I always say buzzword. If you've watched my video, you will never go wrong with buzzword. These are your key. Urinary incontinence, that means we have fluid. Fluid in the perineum is bad. It's going to cause skin breakdown. Pick an answer that is related to fluid breakdown. What intervention is most appropriate to prevent skin breakdown? Apply an occlusive dressing over the sacral area. What are you doing with the fluid? Limits the client fluid intake? No, they need to eat and drink. Clean the perineum area and apply moisturizer as a barrier to prevent the fluid causing friction and causing problem. Reposition the client every 4 to 6 hours is too long. Therefore, what is the key concept here? Fluid causing skin breakdown. Which action the nurse should take? What do you want to do? And let's prepare a client for CT scan with IV contrast. Keyword, CT scan, IV contrast. What do you want to do? They're getting something foreign. They're going to get sick. You got to teach them. Every IV contrast need a bigger IV, at least large bowl IV. Shellfish allergy is no more needed. Or if you have allergy to iodine contrast, yes. But shellfish allergy is not needed. We don't need to check your glucose because you're going to get CT scan, and you don't need a Foley. You need a large bowl IV, anything like 18 gauge and above. After an upper GI endoscopy, the nurse should prioritize which assessment. Like I said, these are simple, straightforward questions, that test-taking strategy to poke your mind and let you know that these are little things you need to know. You should not overthink it. Don't overthink it. I'm giving you a question. Patient has a EGD, upper GI endoscopy. What do you think? I put it through your throat. Gag reflex. Need to come back before you do anything. That's why it's a priority. That's why risk of aspiration. Choose this one. Which client position require immediate intervention? Something is wrong. Positioning is bad. And this is caring for a multiple client following various procedure. Look at the procedure and see that whatever position you put them is a wrong position because it's going to cause problem for the patient, right? I have an ago lumbar puncture. You need pressure on my back. Is the patient flat? Yes, on their back. I have cardiac catheterization. That leg need to be flat. Is it flat? Is supine? Good. I have liver biopsy. You need to put pressure on my right side. That's where the liver is. Am I on the right side? Yes. Test taking strategy. This should be your answer. If you have UGD, risk of aspiration, you should lay on your side, not on your back. Which position the nurse should place the client? A nurse is caring for a client who is now post placement of right tympanostomy due to what? Otitis media. That means they put the tube in their ear because they have ear infection. What is the tube going to do? Drainage. How the tube is going to drain? By gravity. What do you think? Do you put their head back or on the other side? The best way is to put their head on the side that the tube is. So on the affected side, so the tube is down, and that will allow drainage. So affected side. Supine, prone to another back, that's no it has no relationship with the ear. So your ear need to be on the dependent position. You lay on your affected side to allow drainage. What pre-procedure instruction should the nurse provide? That means before the procedure, right? What do you want to do? The client is scheduled for what? A barium enema. What do you know? Do you know anything about it? It's barium. You drink it, and then we take a picture of your colon. It's a contrast, form of a contrast, but it's a chalky substance the patient will drink. Best way, any study that you got to drink something, there should be nothing in your stomach. No food, no stool. Which answer's choice is better? Take your laxative. Avoid drinking clear liquid for 24 hours, fine. But still, stool need to be cleaned out. You must eat a normal diet the day. No, we need to clean you up. You may have mild abdominal cramp after the procedure. Sure, but we're not putting gas there. But the most important, the thing said, question said, question said, question said, pre-procedure. Why don't you do something related to pre-procedure? Pick an answer choice that is pre-procedure, and that is B. What instruction should the nurse give to the client about this medication? Instruction: the client has an order for sublingual nitro, sublingual under your tongue, nitro. What instruction? Swallow the tablet. Is sublingual, you don't swallow it. Place the tablet under your tongue until it dissolves. Definition of sublingual: chew the tablet, is not sublingual. Take the tablet with food, is not sublingual. This way. Which finding require immediate intervention? They're doing something bad. And this is monitoring a client for NG tube. You go to your nose, esophagus, into your stomach. Which one need immediate intervention? Prioritization 101. You have to be sharp. What is going to kill the patient? If you have 1 second and you're seeing it, mild nausea is not going to kill you. 100 ml of gastric residue. Hey, I put the NG tube in there. I expect gastric residue. NG tube secure the tape to the secure with tape. That's what you're supposed to do. Coffee ground drainage means you bleeding. It's blood. We need to talk to the doctor. Be sharp. And then has attended staff education about enema, which match appropriate enema in description. Use all option. This is just content to let you know different kind of enema. But even if you don't know, look at the keyword. I always say buzzword, small volume. A small volume will always be hypertonic. The tap water will have a large volume is going to be hypotonic. Mineral oil is retention enema. That's the different kind of enema for you to know. Which action should the nurse take first? Prioritization 101. You have to be sharp. A nurse is assisting a client with limited mobility to reposition in bed. He can't move. Movement is limited. I need to move them. The best thing you need to do, can they bear weight? Can they help you? Can they understand what you're going to do? Put a client up. It's not the priority. Elevate the head of the bed. It's not a priority. The patient has limited mobility. Figure out what the patient can do to help you. Assess the ability to assist with the movement. I know I'm going to use mechanical lift. All of this is good. But hey, if they can help him, man, they can do it on their own. Which intervention addresses the client comfort need? Once again, comfort need. Answer choice should meet comfort need. A nurse is caring for a client who is NPO and receiving IV fluid. And therefore, NPO, they will be worrying about it. So you provide comfort need, offering frequent snack, it defeats the purpose of NPO. Provide oral care, you're providing comfort because they cannot eat. Their mouth is dry. You swap in their mouth, this is better. You should not give them sips of drink. It said NPO. Turning off IV fluid, the NPO, they need IV fluid. So don't do that. Which of the following clients are increased risk for developing pressure injury? Select or apply. You can see the way I'm answering the question. Like I said, straightforward. Don't beat the battle bitch. Don't overthink the question. Know it and go for the jargon, right? Go for it. And if you know the content, don't like overthink it. Keyword is in the question. Buzzword, I call it. What is the buzzword for this question? Pressure injury. Increased risk. Therefore, if I'm not moving, I'm in trouble. My weight alone does not put me at risk for what? Pressure injury. Weight itself is better if your BMI is high, your bone does not get at there's not too much pressure on the skin to the bone. You have some cushion there. Therefore, you protect it. Client with spinal cord injury, you are not moving. A client receiving chemotherapy, diarrhea, we saw that question. Fluid in the perineum, risk of pressure injury. Client who is elderly, dry skin, likely to break. Hemoglobin A1C, diabetes, poor perfusion, you have a trouble. Risk factor for pressure injury. Concept you need to know. Check Adapt NCLEX and join our membership or our crash course or on demand at http://www.adaptnclassreview.com. We have a new course coming up. If you want to join us or email me at adaptnclass@gmail.com. Okay. For which condition should the nurse implement these precautions? Select or apply. A nurse is applying identify clients who require contact precaution. So which of these patients require contact precaution? Which of these patients require contact precaution? It's called Mrs. Hips. If you don't know it, check Adapt NCLEX. But those are the acronym to find contact precaution. Clostridium, number 1. MRSA, number 1. Tuberculosis, airborne. Scabies, chicken pox is a trap, right? Chicken pox require both contact and what? Airborne. So when this one said contact precaution, it means that's the final idea for that. Therefore, don't pick it, right? Don't pick it. Okay, VRA, contact precaution, right? So pay attention to this. Is a little bit tricky. It's very tricky. If you don't pay attention, you get it wrong. So Chicken pox, you have contact and what? Airborne. But this contact precaution alone, you're not going to do that. You just do this one alone. Okay? Which action should the nurse take when using restraint? What do you want to take? Select or apply. And then she's reviewing proper use of restraint with the new highness. So what do you want to do? You got to teach them, right? Teach them the use of restraint. Secure the restraint tied to a part of the bed frame that moves with the bed, right? That is what he's telling you to do. Secure it with that. Ensure the two fingers can fit between the restraint and the client's skin. Is it a good thing to do? Remove the restraint every 2 hours to assess the client's skin and the range of emotion. Um, Attach the restraint strap to the side rail for quick release. Do you want to do that? Use the restraint as a first line intervention for a client at risk of harm. Is this the best thing to do? Is there any other options you can do? Is there any other option you can do? Document the reason for the restraint and the client respond to them. These are the keys, right? Document that. So first, I'm going to document it and then reason for that. I'm not going to use restraint as the last resort. Attach the restraint to the attach the restraint strap to the side rail for quick release. This is a trap, okay? Even though you may try to think, oh, it's a quick release, you cannot, side rails is not the best way to, best place to attach restraint. It's more likely to be movable and it cause problem to the patient. So you should not do that. Remove restraint every 2 hours to assess for skin integrity. Good. Ensure two fingers can go under the restraint. It's not too tight. And you secure the restraint to tie part of the bed frame that moves with the bed. It moves with the bed. The side rails does not move with the patient hand. So that's why those are the right answer. And so those are the right answers A, B, C, and F. Okay, you got to know something about restraint. And this is caring for a client with newly inserted NG tube. Which action is the most reliable method for verifying correct placement? There's a bunch of ways to correct and check placement. You can do gastric pH, you can do X-ray, you can listen. All of them, the number one, effective verifying correct placement is I need to see it. Which answer choice you can see it is X-ray. Which intervention should the nurse include in the plan of care? Select or apply. A nurse is planning care for a client at risk for what? Pressure injury. We've seen it already, but in the different form, pressure injury. The same thing, bone touching skin and not touching any surfaces, or there's too much fluid, or you're not moving. So use that strategy to figure out. Change client position every 2 hours, even while in bed. The nurse should include in the plan of care. I'm going to do it. Use a donut is a bad thing. It's more likely to cause what? Pressure injury than you think. Keep the client's skin clean and moisturizer, no fluid. Recommend a diet high in protein and vitamins. Yes. Massage. Don't massage it. It's going to break easily. Reading area to increase circulation. It's a trap. Use pressure relieving devices such as foam and gel cushion to help with that. These are the things you do to prevent pressure injury. Which instructions should the nurse include? Select or apply. A nurse is teaching a client on the non-weight bearing right leg how to use crutches. Watch for this question carefully before you get it wrong. You stop the video and try to clean it and answer it yourself. But this is what the question is saying. Non-weight bearing right leg. If you see examiner give you something like that, they want to confuse you. Non-weight bearing right leg. All it means is right leg is injured. That's all. And you're teaching them as you use crutches. So what do you want to do? Place the crutches about 6 inches in front of you while you're walking is good. Support your weight on your hands instead of your armpit is good. When going up the stairs, you go with the good leg. When going up stairs, lead with your crutches first. You shouldn't do that, right? slightly below 15 and 30 degrees while you're holding the crutches. Are you going to do that? When going down the stairs, lead with your crutches first. You should not do that, right? Assume 3-point stand, lead with both crutches, an injured leg, followed by uninjured leg. As you can see, this is much better answer. That is 3-point stand. Then you lead with both crutches, and then your injured leg before the uninjured leg to provide support. That's 3-point stand. When you're going down the stairs, right? When you're going down the stairs, you want to do that, lead with your crutches. I told you, when you're going up the stairs, you go with the good leg. Therefore, when you're going down the stairs, you go with the bad leg. So the bad leg, before the bad leg, crutches go first. Keep your elbow slightly 15 to 30 degrees. That's good. Moving your crutches and your injured leg forward at the same time is not good because then you're going to fall. Crutches, then injured leg, then the good leg. When going up the stairs, lead with your crutches. You should not lead with your crutches, like I told you. That is, go up with the good leg. Support your weight on your hands and place this 5 inches, 6 inches in front of you. These kind of questions, they're tricky, but you got to stand your ground. Otherwise, you get full and you lose the point, okay? Which of the following findings are appropriate for prevention? That means I want to prevent fall. A nurse is performing home assessment for a client at risk of fall. Which of this is appropriate? Client engaging in moderate exercise. Good. He's exercising. Small thin size aerial rug doubly secured on all sides. This is a trap, right? People would think that is bad. No, it's a small, it's very thin, and I've doubly tape on both sides. It's okay. Grabber in the bathroom near the toilet and shower is good. Wear socks when you walk in is good. All the room have lights, especially in the hallway and staircase is good. You have eye exams every year is good so that we can fall. We can see if you have vision problem, you get glasses. So all of them are good. What is the best action by the nurse? What is the best action by the nurse? A nurse is providing care for a client on comfort care who is in the final stage of terminal cancer. The client reports pain rate out of 8 out of 10, despite receiving scheduled pain medication. What is the best action? The keyword and the buzzword in the question is comfort care. Patient is on comfort care. There's no need to be shy of medication. That is the concept here. Every time you see a question on comfort care, don't be shy. Patient has pain, you're giving them their scheduled pain medication. They may need a breakthrough pain. Notify the healthcare provider to adjust the client pain medication management. Okay, that's not bad. Reassure the client that the pain medication will take time. They have comfort care, they don't have time. Administer a breakthrough dose of the prescription pain medication. There may be a big breakthrough pain medication prescribed by the doctor. Use distraction technique. They are on comfort care. So it's between A and C. Which one you want to do? Give them breakthrough pain. What is the next priority action after client death is confirmed? After the patient is dead and we confirm. And let's find a client unresponsive and call a code. Despite resuscitation, the client is pronounced dead. So what do you want to do? Client is now dead. So what are you going to do? Notify the healthcare provider and document the time of death. Is that a priority? Provide emotional support to the family and offer privacy to the grave. Follow institutional policy for postpartum care and ensure client integrity. Report the death to the local examiner and coroner if required. Look at it. Priority, the most important thing after they die is you want to make sure there is no autopsy. This is a sudden death. But at the same time, you want to provide some integrity for this patient. The best thing to do is to not follow some institutional policy for postpartum, right? You have to wait and make sure there's no autopsy or anything. At the same time, you keep their body in certain position so that there's no discoloration of their face. So this answer choice is much better. Which action should the nurse take first? The nurse is performing postpartum care for a client who has just passed away. That's the same thing. I'm trying to give you content. That's why I follow it with this. He just passed away. What do you want to do? Remove all medical devices such as IV lines and catheter. Do you know you're supposed to do that? Yeah, is this patient going to have autopsy? You don't know. Don't remove anything. Position the client supine with the head of the bed slightly elevated. Yes, their head is up so that blood can pull down and it doesn't affect their face. Notify the air care provider and document the time of death. Is they are important. Cleanse the body and provide fresh linen. They are important. But the most important thing is make sure we prevent discoloration. Which should the nurse recommend? A nurse is teaching a client with rheumatoid arthritis about selective appropriate furniture to reduce joint strain and promote comfort. Which chair should you give it to them? It's a test-taking strategy. Rheumatoid arthritis, they have joint pain, and the best thing is to keep this the joint in line. You should avoid anything that is soft. They shouldn't sleep on a soft bed. You should sleep on a hard bed, and it should be flat on it all the time. So a firm straight back chair is much better than something that is reclining or is soft and being back. They are all soft. That's the concept. Anything soft is bad. So firm is good for these people. Which action the nurse should take first? A nurse is caring for a client admitted for what? Pneumonia. After 48 hours of anti-infective, the nurse observed multiple loose foul smell. What do you want to do first? Antibiotic for pneumonia. I'm having diarrhea, is smelling. That's sedative. The next thing you should do, contact precaution. Which of these is contact precaution? That. Wear non-sterile surgical mask. You don't need a mask. You need a gown and gloves. Hand hygiene, using hand sanitizer. You got to wash your hand rather than hand sanitizer. You don't need to wear face shield during routine care. So this one. Which action observed by the nurse demonstrate to a client that a client with one non-weight bearing leg is using crutches correctly to navigate stairs? It's the same thing I told you. One leg is affected. I'm using crutches. Go up with the good leg. Come down with the bad leg. Crutches before that. That's all. And then the concept will follow, right? Lead with the weaker leg when going up. It's wrong. Lead with the stronger leg when going up. It sounds much better, right? You see concept, 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 right? But which one you should do? Place both crutches on the side away from the right, or use the handrail with both hands. Is that good? I don't know. You tell me. So which one is called correctly navigate? That's the key word. Crutches correctly to navigate the stairs. So use the handrail with both hands to support. You're going to fall. Place both crutches on the side away from the handrail. So what you do is when you place both crutches on the side away from the handrail. When you go into the stairs, they are always, you got to put it away. And then you use the one close, you want your hand that is closer to the handrail that you can use it to support yourself, right? When you're going down, you use what? The crutches first and the weaker leg. And then lead with the weaker leg when you're going up. It's a wrong answer. So this is a right answer. I'm trying to trap you, but I want you to think about how they can frame you with that. Think about it. Lead with the weaker leg when you're going up the stairs. You lead with the good leg. Lead with the stronger leg when going down the stairs. Usually with the crutches and the bad leg. When you're going down or going up, both of them, the crutches need to go away. So you have to give it to the non-dominant, mostly the left hand, because if your right hand will be, or depending on where you're going, but your crutches should be away from the handrail so that you can use one of your hand to help with that. So that's why this answer choice is good. Which of the following intervention will be the most appropriate to address potential blood loss during surgery? A Jehovah's Witness is scheduled for surgery and has refused blood transfusion due to religious belief. It doesn't want to accept any medication. So which of those is most appropriate to address potential blood loss? All right. Administer erythropoietin to stimulate red blood cell. Use donor platelet transfusion. Prepare for autologous blood transfusion. Administer fresh frozen plasma to maintain coagulation. This is a trap, right? Jehovah's Witness, it does not like blood product. If you see any blood product, don't pick it. What is a blood product? Fresh frozen plasma, it's a blood product. Platelet is a blood product. They don't like to use their own blood if you take it before they go, right? Because it's going to be refrigerated. So autologous blood transfusion collected before. They will take blood that is collected right during the surgery, the warm blood, right? So erythropoietin is the best answer. Which of the following statement or intervention may be acceptable to the client? This is the same content. Select or apply. And this is preparing Jehovah's Witness client for surgery. The client has refused blood transfusion due to religious belief. Which one would they take? They will take erythropoietin. They will take some blood. They will not take autogenous blood transfusion collected before surgery because you got to refrigerate it. Intraoperative blood, they will take it for reinfusion. Platelet transfusion from a donor is a blood product. Iron should be fine. The next will be able to cohort the client in the same room with which of the following? Which one will you be able to cohort with which of the following? Think about it. And next is admitting a client diagnosed with hepatitis C, right? Hepatitis C is a standard precaution, straightforward. Therefore, if you're not standard, you're not going to be in the serum. Pertussis is droplet. Hepatitis C, same organism, right? No infection. Alcohol is not infection. It's also standard. Liver cirrhosis is standard precaution. Client with active varicella, you need what? Contact and drop airborne. Patient receiving leukemia is immunocompromised. So A, C, B, and C are the right answer. What is the correct next action? And this is caring for a terminal ill client who has few weeks to live. Client is refusing all food except sips of water. The family member are distressed, right? Oh, it just does not want anything. So what do you want to do? All you want is just a sips of water. What do you want to do? Think about it. What do you want to do for this patient? What do you want to do? What do you want to do? What do you want to do? Recommend force feeding? Recommend NG tube feeding? Discuss end-of-life physiological changes with the family? Find out more about the family fears and their concern. What do you think is the best option for this situation? Do you want to find out more or discuss with them about life changes with the family? And then you can find out more about their fears and they have to know what is going with the patient, right? You discuss the end of life physiological changes with the family, then you can find out more. If you tell them, then they will tell you what is going on. So it's better to discuss with them physiological changes associated with that, and then that will help with them. If you educate them, it will address their end of life. This is a little bit tricky. That's why I went through the discussion. But as you see, I say the next role include educating the family about normal physiological changes during the dying process, such as decreased anger and thirst. Addressing these changes can help alleviate the family distress and allow them to provide supportive care aligned with the client's needs and wishes. Which action should the nurse prioritize? A new graduate nurse is caring for a client who requests assistance moving from the bed to the chair for the first time. We've seen this question, similar one before. I want you to drill down to the concept. It's going to move from one place to another. But with bearing status, what can they do? How can they help you? Bed can be locked. I don't care about it. Bed rail, I don't care about it. Bed chair, I don't care about it. Look, your weight bearing status so that I can know it, I don't break my back. Which important instrument must the nurse have at bedside? A nurse care for a client admitted for upper GI bleeding requiring Blakemore tube, right? Which instrument should you need? This is the Blakemore tube. Go through your nose and it has balloon in your stomach, balloon in your esophagus, get inflated, and that prevent bleeding when you're having upper GI bleed. What do you want to have? Best thing you should have is something to cut this if this dislodge and go to your airway. Scissors is always number one. Tongue depressor is not going to help you. Suction catheter, amber bag is no. This is number one. Scissors. After discharge instruction on how to walk on the stairs, which statement by the client indicate effective teaching? There's a reason why I keep on going back into crutches and cane and other thing, because they like asking it, and I want you to master it because you watch adapting class. So which one? And let's care for a client with what? Left tib fifth fracture is non-weight bearing on the injured leg for 6 weeks. That means the left leg is gone. 6 weeks, you can bear weight. Which discharge instruction on how to walk on the stairs should the nurse include? Indicate need for effective teaching. Indicate effective teaching, right? Indicate effective teaching. Basically, which one indicate effective teaching? So which one? I will go up with the on injured leg and keep the injured leg behind. It sounds good, right? Go up with the which one indicate effective teaching, not the need. Going up with the good leg is better than going up with the bad leg. So go up with the uninjured leg and keep the injured leg behind is good. I will go down first with the uninjured leg. You go down first with the injured leg. I will go up first with the injured leg while keeping the good leg behind. I will place the injured leg to bear weight while coming down the stairs. You see, you can't go out first with the injured leg that's gone. I will place the injured leg to bear weight while coming down. You have to push the crutches first before the injured leg, right? And so this one is the much better answer. Next question. A nurse is teaching a client to use the inhaler. Which instruction is the most important? Inhaler. Breathe in deeply while pressing down on the inhaler. Yeah, you get oxygen or whatever you get in inhaler. Hold the inhaler at least 2 inches away from your mouth. That's too far away. Use the inhaler after meal. You should not use it after you eat, right? It can affect it. Wait for 10 minutes is too far away. 1 to 2 minutes what to use the inhaler again. 10 minutes is too far. So taking a deep breath is good. Which of the following intervention is the most appropriate to ensure the client's safety? A nurse is caring for a client who is confused and agitated. Confused and agitated. You want to provide an environment that is good for them, that they can listen to you because they're confused, agitated. Use restraint to prevent the client from falling. It's a bad thing to do. Provide calm, quiet environment, arrange the client as needed. It's much better. Allow the client to roam freely in the unit. He will be confused. Encourage the client to stay in the bed with the side rows up. You are restraining them. So this one is good. Which action is the most important to prevent complication related to the IV infusion? And this is assigned to a client, assigned to care for a client who is receiving IV fluid infusion. Which one will prevent complication? Monitor the site, check the flow rate, change the IV dressing, or flush the IV every 2 hours. Flow rate, how fast it's going, is the problem. Which of the following intervention is most important? A nurse is caring for a client is experiencing difficulty swallowing. If I'm difficulty swallowing, aspiration. How do I prevent aspiration? Pick an answer choice that will prevent aspiration. Offer client large amount of fluid, bad. Offer thick liquid, it prevents aspiration. Provide small frequent meal. Encourage client to chew gum. They have swallowing problem, they will aspirate. Keep the client in the supine, they will aspirate. Which of the following actions should the nurse take? Always try to come up with one concept to answer the question and don't beat about the bush. Go straight to it. And that is what I'm doing. I'm trying to teach you. And nurse is preparing to administer medication via NG tube. Which of actions should the nurse take first? NG tube. I'm going to put fluid in it. I got to make sure it's in the right place. That's all. Check placement. Flush the tube. Before you flush, you got to check placement. Position the client on the left side. You got to make sure the tube in the right place. They should not be on the left side. They should be upright. Mix the medication with warm water. Whatever fluid you're going to use, fine. But you got to check placement. Which intervention is essential to prevent spread of infection and necessary care for a client with tuberculosis? Intervention prevent spread of infection. Put them in the airborne precaution. Place the client in a room with what? Positive air pressure. No, positive, negative air pressure. Use airborne precaution, including N95. Keep the client door open for ventilation, no closed at all time. Wear sterile gloves when in contact with the patient. You don't need to wear gloves. And nurse is preparing to administer an intramuscular injection. Which site is the most appropriate for an adult client? Not the deltoid, not the vastus lateralis. Ventrogluteal muscle is the best place to inject it. Which client the nurse should see first? A nurse is at the scene of explosion. Prioritization 101. You got to be sharp. In the explosion multi-trauma, person who is going to leave. If you're dead, you're dead. Client killed in the explosion is dead. Client exposed brain is dead. Broken leg, okay, is not dead. Large scalp laceration and soaked dressed. So your leg is broken and this guy is bleeding. I'm picking this one. The pain at 8 out of 10. How should the nurse assess the pain? Pain is subjective. It's not objective. There's no way, whatever they tell you it is what it is. Ask the client again about the pain. Let it be. Look for facial expression. It's not good. Document the client reported pain exactly as they subscribe. It's a subjective, basically kind of pain. So you can't tell whether it's 9 out of 10 until the patient tell you. Which finding require immediate intervention? And nurse is reviewing client laboratory value. Hemoglobin 10, platelet of 90,000, sodium 145, white cells of 2,000 is due to panic. This is dangerous. This is sepsis. This is bad neutropenia. How should the nurse respond? A nurse is caring for a client who has recently been diagnosed with terminal cancer. The client expressed anger, stating, I can't believe this is happening to me. Therapeutic communication. Answer their question. Don't talk. If you want to talk, ask for more information. You should feel angry. Everything happened for a reason. Bad answer. It's normal to feel angry. I'm here for you if you like to talk. This is good. Let's focus on staying positive. He's talking. Focus of what? He just tell you how you feel. I will ask the doctor to explain. He's asking you. So ask for more information. Number B is the right answer. When should the client perform this assessment? During a routine checkup, the nurse teaches the client about breast self-exams. When do you do it? After your menses, a week later. What is the answer? 1 week after your menses. Whenever they feel tenderness in the breast, no. On the first day of the menses, your breast is bumpy. 2 weeks before the start of the breast and menstruation cycle, breast is still bumpy. Not good. What statement by the client indicate a need for further teaching? And nurse is providing prenatal education to a client who is 10 weeks pregnant. Therefore, they're doing something that will make them sick, immunocompromised, or anything like that. Or they saying something that is wrong. I will avoid all type of sweetness during my pregnancies. Yes, I should avoid food like sushi and raw. Make you sick. I expect to gain 7 pounds in the first trimester. The pound you gain is 1.1 to 4.4. You don't gain 7 pounds. I need to take folic acid daily. Therefore, the right answer is to prevent neurotube defect. Right answer is 7 pounds. Is wrong. Which action demonstrate compliance with right documentation? So which one is the right documentation? When administering medication, the nurse adhere to 6 right of medication administration. Documentation, you did the thing and you write it. Verify the patient allergy is not documentation. Charting the administration immediately after the medication is that. Confirming the patient identification using to identify is not documentation. Informing the client about the name and the purpose of the medication is not documentation. I'm not going to distract you. I'm just focusing on document, document, document. And the answer choice has to be document, document, document. Which diet option is appropriate for a client with end-stage renal disease? Concept. In the renal disease, their potassium is high, so avoid potassium. Their phosphorus is high, avoid phosphorus, right? Their sodium is high because of, you want to avoid high sodium because of fluid retention. Therefore, what? Low sodium, low potassium, high phosphorus is wrong. Low sodium, low potassium, low phosphorus. So that's that one. Which of the following clients should be evacuated first in a hospital setting fire? A nurse is providing education program about fire evacuation protocol. Which of these patients do you want to evacuate first? Key concept. Whenever there's fire, always take away the one who can walk. Ambulatory patient. Intubated patient, you can walk. Portable oxygen and you have pneumonia, you can walk. You go first. NG tube, high grade dysplasia, you connected. Cervical spine, you can walk. Therefore, number one, B is the right answer. Anyone who is ambulatory is the first person to walk. Which of the following information should the nurse include? A nurse is teaching a client who is scheduled for percutaneous kidney biopsy. What do you want to include? I will check your gag reflex before oral intake after the procedure. We don't put anything into your mouth. It's local anesthesia. I will hold your blood pressure medication before the medication. No, you should give the blood pressure medication because we want to make sure your blood pressure is not too high. You will need to empty your bladder. You don't need to. You'll be in the prone position for the procedure. Yes. Which lettered vein the new graduate should target? And a charge nurse inform a new graduate nurse to insert a peripheral IV in the cephalic vein due to client difficult IV access. So we're looking for cephalic vein. You look at the diagram, which is cephalic. Cephalic, the best way to remember cephalic is cepha is up, cephalic. So this is up, this is a medial, this is lower towards the body. So this is base, basilic, this is cephalic, right? This is joined together. So these are the cephalic and basilic. So A is that. That's how you can remember them, okay? Which of the following action a teaching is appropriate or inappropriate? A client diagnosed with insomnia asks the nurse about what? Sleep hygiene. Which one is appropriate, inappropriate? Eat large amount of carbohydrate is inappropriate. Take nap during the day is inappropriate. Limit time to fall asleep in bed. Yeah, when you go and sleep to 20 minutes, if you have no fall asleep, just get out. Appropriate. Keep the room on the cooler side. Appropriate. No caffeine. Appropriate. Exercise more than 2 hours, at least like either 4 or 5 hours before you go to sleep is appropriate. So those are our sleeping hygiene. Which statement by the client indicate effective teaching? And nurse is providing teaching to a client with newly placed ileostomy. Which one is effective? I will change the stoma appliance when you're almost full. No, 3/4. I will keep the stoma dry to prevent bleeding. It should be moist. I will apply skin barrier during stoma change. Good. I will limit fluid intake to 800 ml. No, 2 to 3 liters. After teaching a new graduate on standard precaution, which action by the new graduate indicate effective teaching? I will perform hand hygiene with alcohol-based hand sanitizer after blood transfusion. I will wear sterile gauze for routine care. I will wear gloves and gown when irrigating a wound. I will perform hand hygiene before and after what? Seeing a client, right? So hand hygiene with alcohol base, you should wash your hand. I will wear sterile gloves. You should not wear sterile gloves for routine care. I will wear gloves and gown when irrigating a wound. You should wear face shield in addition. Hand hygiene before and after seeing the patient is better. Which infection control measures should the nurse institute? A nurse is caring for a client who has pertussis. This is Droplet. Which of these is Droplet? Keep client door closed at all time. You don't need to. Ensure all visitors wear N95, no masks. Non-surgical mask. Remove any portable fan in the client's room. Yeah, it will aerosol all the droplet and go out. So remove it. Place the client in a semi-private room, another client with impetigo. No, it should be the same organism, not precaution. So B, remove all the fan. Which action by the nurse is in the plan of care is the most effective in preventing complication? A nurse is caring for a client who is post-operative abdominal surgery. Which one will prevent complication? Get out of bed. Ensure IV access is patent. Okay. Provide oxygen. It's okay. Early ambulation. Providing nutrition. Getting out of bed will prevent infection, will prevent DVT, will prevent pneumonia. It's good. Disposable equipment. This is a trap, right? Varicella contact and what? Airborne. Therefore, droplet is out. Yes, you need to put them in the pressure air room, but it's not positive. It should be negative. You don't place any respiratory marks on the patient while they are in the room. Therefore, single-use equipment is better. A nurse is assessing a client with insomnia. The client state, I spend a lot of time laying in bed before I can fall asleep. That means you go and sleep on the bed. It takes forever to fall asleep. What should be the nurse response? Well, don't go on the bed until you're ready to go. Eat a large meal is not good. Keep the room temperature warm. It should be cold. Read your favorite book and then in bed until you fall asleep. No, limiting your time in bed for 20 minutes is much better than going and sitting there forever to go. And this is inserting an indwelling urine catheter in the male client. Order the steps the nurse should take. All options must be used. Therefore, if you're inserting Foley in the catheter, what do? Pull the catheter onto the resistant felt, advance the catheter slightly, advance the catheter onto urine flow, advance it to the bifurcation and inflate. So the first thing you do, advance it until urine flow. Then you advance it to the bifurcation, right? Then you inflate the balloon, right? Then what are you going to do? You pull the catheter until there's resistance, and then you advance the catheter slightly as much as possible. This is the way you're supposed to do after, in order to prevent pressure, right? You want to prevent pressure on the ureteral portion of the bladder neck. So advance it until you get urine, advance it to the bifurcation, inflate the balloon, then pull it back until you get resistance, then push it back again. Which action by the new graduate need immediate intervention by the charge nurse? Explain a new graduate nurse is inserting NG2 for a client with a small bowel obstruction. Which one need immediate intervention? Explain the indication for the NG2 to the client. It's fine. I don't need to intervene. Instruct the client to take short sips and swallow during the insertion. That is good. Provide straw for swallowing, right? Elevate the client at 90 degrees and advance the tube as the client inhale. No, they should not advance it while they inhale. You should advance it while they swallow. Advance it while they swallow, not when they inhaled. So this one need intervention. The client should advise the nurse should advise the client to clean the mouth with what? A nurse is caring for a client receiving chemotherapy who develop stomatitis. That means inflammation and sore in the mouth because of the chemotherapy. They should avoid acidic drink, whatever is going to cause more pain. Chlorhexidine will do that. Providine, hydrogen peroxide will do that. Lemon will do that. Alcohol will do that. Just saline is the best way. Swiss and speech saline mouthwash is the best one. Only one answer. What type of pain the client is describing? During the nurse assessment, the client described pain of 5 out of 10 that is purely localized, shooting, and shock-like. Shock-like and shooting are neuropathic pain. Visceral pain cannot be specifically localized. Somatic pain can be localized. Musculoskeletal pain is near the muscle pain area. Which intervention is appropriate to prevent the spread of infection? And this is caring for a client with the emergency. It's a contact precaution. What do you want to do? Surgical mask is not needed. Gown and gloves when providing care, better. Place the client does not need negative pressure room. Wear sterile gloves. You don't need sterile gloves. Which of the following tests is the nurse performing? A nurse is performing high exams. The nurse asks the client to gaze at the distance, look at it, and then quickly gaze at the pen in front of the client, at the test object, right? You look at it and you quickly, what are you doing? Visual acuity is Snellen test, so that one is gone. Cranial depth 7 palsy, right? You know Bell palsy? Yeah, it's not. Pupillary reflex, you put the light and see how the light go. Therefore, just by elimination, that is accommodation. Which action by the nurse indicate effective teaching? A nurse is teaching the client how to ambulate with the cane, right? Effective teaching. Cane should be always on the good side. Advance 12 to 16, 18 inches with each step, you're going to fall. Client position the cane on the wicked side, you're going to fall. Client measure the height of the cane from the waist crest, that's good. Client advance the cane after a step with the weaker, no. So this one is good. And this observes that stress in a non-diabetic client causes a physiological alteration leading to hyperglycemia. Which hormone is likely responsible? Oh, I'm asking you, what is the stress hormone? Insulin, glycogen, cortisol, aldosterone. Insulin decreases your glucose. Glycogen is a storage form of glucose. Corticosteroid increases your glucose. Aldosterone has nothing to do with your glucose. So that's the right answer. What should the nurse do? And a client who is scheduled for surgery asks the nurse to explain the consent form again. What would you do? Explain the consent form again. Are you supposed to do anything? Review the risks and benefit for the client with the benefit of the surgery with the client. You should not do that. Instruct the client to sign the form and discuss it with the surgeon. No, later, no, you are not the one who's supposed to obtain it. Notify the surgeon to provide further explanation. Yeah, you can notify and clarify basic details and contact the surgeon for further explanation. You see, this one is much better. Basic details. What exactly does the patient need? He says, explain it again. That means the doctor is explaining to him. So, what kind of specific do they need? Give them basic information and call the doctor to come and further deal with it. So thank you for staying with us through the end of it. I hope you gained something. I'm happy you learned something. If you like it, share the video with your friends or join our membership and then learn more content. Support our membership by joining our membership. It's a small token to keep us going. And then if you want more, you can join our crash course or our on-demand, which is a specific few videos geared towards the NCLEX to keep you going in a very short, precise way. Take care of yourself and thank you for joining us. Bye.